Regarding decontamination and biomedical waste management, disinfect any surface or material known to be or potentially be contaminated. We have to identify and segregate contaminated material before decontamination and or disposal as biomedical waste guidelines. Where contamination has occurred but the process of decontamination is not possible, like the laboratory, we need to package the contaminated waste for transfer to another facility with decontamination capacity. So while decontaminating the equipments and the waste and the biomedical waste generated as a result of patient care, one has to ensure that heavy duty gloves are put on, along with disposable long sleeved gown, eye goggles or a face shield and a medical mask. Now coming to contact precautions. The contact transmission between an infected or colonized person and a susceptible host can be through direct contact. Either it is body to body surface or it can be indirect through fomites. So all the patient's belongings, the patient care items present in the patient care unit, they can act as fomites. Contact precautions can be observed by ensuring frequent hand hygiene, making use of personal protective equipments, and decontaminating the items more frequently. Here I would like to say that there are two types of surfaces available: low touch areas and the high touch areas. High touch areas are required to be cleaned more frequently. Again, we have clinical areas and non-clinical areas. So in clinical areas, maybe every 1 to 2 hourly, the high touch areas like the door handle, the switches, buttons, knobs of the monitor, they can be cleaned more frequently, like 1 to 2 hours. While in non-clinical areas like the laboratory, the frequency of cleaning can be every 3 to 4 hours. Finally, handling the dead bodies. When handling of dead bodies is concerned, we have to avoid direct contact with blood or body fluids from the dead body. Put on personal protective equipment. Make sure that if healthcare professional has any wounds, cuts or abrasions, they are covered with waterproof bandage or dressings. We are not supposed to be eating, drinking or smoking near the dead body. Do not touch your eyes, mouth or nose. Observe strict personal and hand hygiene. Avoid sharp injuries which can occur during the course of examination of dead body and decontamination. Remove personal protective equipment after handling of the dead body. Wash hands with liquid soap and water immediately. In case of accidental exposure to blood and body fluids, for example, it's a percutaneous injury or a mucocutaneous exposure, one has to wash the site thoroughly with soap and water. For example, if the splash is in the eye, then we need to wash the site with copious amount of water. If it is percutaneous type of injury, there we need to thoroughly wash it with soap and water. All such incidents of percutaneous or mucocutaneous exposures are to be reported and we have to immediately seek the medical advice. When we have a patient coming to us in the triage area or in the ward or ICU, how we are going to assess a patient for COVID-19? First of all, we have to take history and identify if in the past 14 days since the first onset of symptoms, a history of either travel to epidemic area or close contact with a person known to have COVID-19 illness. And the person has fever or symptoms of lower respiratory illness such as cough, shortness of breath. Along with this, person can have cough, dryness of oral cavity leading to progressive cough, fatigue, malaise, and later on some kind of GI symptoms such as vomiting and diarrhea can also be noticed. So if both exposure and illness are present and confirmed by the laboratory test, we need to isolate the patient. These patients should have the face mask on them. Isolate the patient in a private or a separate room. Wear appropriate personal protective equipments while providing care to these patients. Continue to assess their clinical status and provide appropriate treatment. Assess and triage patients with acute respiratory symptoms and risk factors for COVID-19 so as to minimize the chances of exposure. So the patients who are reporting with acute respiratory symptoms or some risk factors, they are to be immediately triaged and they should be placed in an isolated area. Make them put on the face mask and place them in the examination room with the closed door in an airborne infection isolation room if available. Now we move on to the nursing care. While providing nursing care to these patients, we have to observe barrier nursing. Barrier nursing is a special kind of nursing provided to the patient so as to protect the healthcare professionals from acquiring the infection with which patient has got admitted and further preventing the spread of infection from one person to another person. The patient under investigation or a confirmed case has to be admitted in an isolation room with negative pressure and at least 6 to 10 air exchanges should take place per hour. Only the essential personnel should enter the room. We need to restrict the entry of all the healthcare professionals present in the ward or ICU. Only few dedicated personnel should be allowed to enter the room. Make use of dedicated or disposable non-critical patient care equipment such as thermometers, blood pressure cuffs, saturation monitoring probes, etc. If the equipment is to be used for more than one patient, clean and disinfect such equipment before use on another patient according to the manufacturer's instructions. Healthcare personnel, while entering the room or soon after a person or a patient when vacates the room, should continue to use respiratory protection. So the healthcare personnel entering the room soon after a patient vacates the room should use respiratory protection. Few words about the safety of healthcare professionals. Many times it can happen the personal protective equipment loses its integrity, it's torn, or it is not properly used by the healthcare professionals. In such situation, we have to seek the medical help. When to contact the occupational health services? We have to contact the occupational health services in case of unprotected exposure, that is, not wearing or inappropriately using the recommended PPE. To a confirmed or a possible COVID-19 patient, contact supervisor or occupational health services immediately. So whenever there is a history of unprotected exposure by any healthcare personnel, the person has to contact the supervisor or the occupational health services immediately. If one develops symptoms consistent with COVID-19 such as fever, cough, or difficulty in breathing, don't report to work and should contact the occupational health services. So finally, there is a take-home message for the healthcare professionals. The nurses and the doctors, they are the frontline soldiers to fight a battle against COVID-19. We have to ensure that the protective measures are used. Take protective measures in workplace. Learn properly how to use the PPE. Donning of PPE as well as doffing of PPE is essential so as to protect oneself from getting sick. Encourage all the members of healthcare team to take protective measures. This is a time to remain calm and composed and encourage all the healthcare team members to observe the personal protective measures, the safety measures, the standard measures, universal precautions, and transmission-based precautions. So with this, I conclude this webinar. This is the list of references from which